Seratonin syndrome. What is serotonin syndrome? It is, where does it come from? Seratonin syndrome is a result of taking SSRIs, selective serotonin release inhibitors, which are antidepressant drugs. So when you're taking antidepressant drugs, one category is SSRIs, selective serotonin release inhibitors, and taking too much can lead to serotonin syndrome. Now, following the use of multiple SSRIs may increase the effects of hydantoins, benzodiazepines, carbamazepines, which is seizure medication, haloperidol, hence the halo, St. John's wort, which seems to be contraindicated with everything, sympathomimetics, which is acetylcholine type of stuff, theophylline, warfarin, hence the gun, tacrine, sumatriptan, phenothiazines, clozapine, beta blockers, and tricyclic antidepressants, hence the 3 circles. These are things that will increase in effect due to serotonin syndrome. What are the symptoms of someone having serotonin syndrome? Symptoms are diaphoresis, they will sweat a lot, tachycardia, increased heart rate, myoclonus, I'm not sure exactly, change in mental status, 5150, restlessness, hyperreflexia, labile blood disorder, shivering, and tremors. So someone is shaking, sweating, increased heart rate, myoclonus, which is probably some kind of seizure-looking thing, looking crazy in mental status and can't sleep and just chill out, and they're hyper-reflex, so they're like twisting, moving, shaking. I mean, this guy is obviously something wrong with them if they have these symptoms of serotonin syndrome. And again, when should you discontinue? Well, it could be fatal if not discontinued, number 1, so that can be bad. When do you discontinue? Basically, when you discontinue, you must stop the offending agent. So whatever SSRI is causing serotonin syndrome, you must stop immediately, ASAP. The doctor will give drugs to block serotonin receptors. So he wants to block the serotonin receptors so it will stop, giving the serotonin syndrome. This will prevent seizures and muscle rigidity and relieve some of the hypothermia that's being experienced. And artificial ventilation may be required, so you might need to call an RT or have a ventilator nearby because they can't breathe because of all this stuff happening. Serotonin syndrome occurs, when does it occur? It occurs when using MAOIs, monoamine oxidase inhibitors, concurrently, and other drugs that increase serotonin. Some of those drugs that increase serotonin and can cause serotonin syndrome are tryptophan, amphetamines, other psychostimulants, other antidepressants that increase 5-HT, which is basically serotonin, buspirone, lithium, dopamine agonists. These drugs can increase serotonin and give you serotonin syndrome.